Welcome to the deep dive. Today we're digging into something your sources point out as a pretty concerning trend. Rising rates of HPV-related throat cancer.
That's right. Oropharyngeal cancer, specifically back of the throat stuff.
Okay, so our goal here is to kind of unpack that. Look at the difference between these HPV-linked cancers and the other kinds.
And crucially, what you can actually do. We're leaning on insights from Dr. Katharine Price at Mayo Clinic here.
Great. So the sources really flag this oropharyngeal cancer as, well, a fast-growing type.
It is a noticeable increase, but it's not just one thing,
Right, not monolithic. Your materials split it into two main camps.
Exactly. You've got the cancers linked to HPV, the human papillomavirus.
Okay.
And then you have the ones caused by other factors, like traditionally smoking and drinking.
And this distinction matters a lot, apparently.
Oh, definitely. Because the HPV-positive ones, they often behave quite differently biologically.
How so? Your sources mentioned a really striking statistic here, something like 70%.
Yeah, roughly 70% of head and neck cancers are linked back to HPV now. It's a huge proportion.
Wow.
And here's the key thing Dr. Price points out. Those HPV-related cancers, they generally respond better to treatment.
Better response, meaning?
Meaning the way the virus interacts within the cancer cells, it sort of makes them more vulnerable to therapies like radiation and chemotherapy.
Ah, I see. So potentially higher cure rates for those ones.
That's what the data suggests, yes. Better outcomes, generally speaking.
Okay, that's, well, somewhat reassuring on one side. But what about prevention? What can you, listening now, actually do? Dr. Price outlined some steps.
3 main things really stand out. Number 1, avoid all tobacco, period.
No surprise there. Smoking, chewing, all of it.
All of it. It's a major driver, especially for the non-HPV types, but just bad news all around.
Okay, what's number 2?
Minimizing alcohol. Again, maybe more strongly linked to the non-HPV tumors, but still a significant risk factor across the board for head and neck cancers.
Right, and Dr. Price mentioned something about them together. Smoking and alcohol.
Yes, a synergistic effect. They really amplify each other's damaging potential, particularly for those non-HPV cancers. It's like 1 + 1 = 3 in terms of risk.
Yikes. Okay, so no tobacco, cut back on alcohol. What's the third preventative measure?
This one ties directly back to HPV, getting the HPV vaccination.
Ah, the vaccine. So it's not just for preventing, say, cervical cancer.
Not at all. It targets the specific high-risk HPV strains that cause the vast majority of these HPV-related throat cancers, too. It's a really powerful preventative tool.
So vaccination is key for the specific rising type of throat cancer.
Absolutely. Getting vaccinated, ideally before exposure, can drastically cut your risk.
Makes sense. Anything else on the prevention side? Dr. Price mentioned diet too, I think.
She did. Focusing on a healthy diet. Think whole foods, lots of fruits and vegetables.
And less of the other stuff.
Right. Minimizing processed foods, refined sugars. It's about supporting your overall health and, your immune system.
While maybe not directly stopping HPV infection, a healthier body is generally better at handling things.
That's the idea. Now, obviously, treatments exist. Surgery, radiation, chemotherapy, if cancer does develop.
Yeah.
But Dr. Price really comes back to prevention being paramount.
Yeah, that seems to be the main takeaway, especially since even the more treatable kind is still, cancer.
Exactly. Prevention is always the best strategy.
Okay, so let's recap quickly. We're seeing a rise in throat cancer, specifically the kind linked to HPV.
Accounts for about 70% of cases now.
It's distinct from non-HPV throat cancer, often responds better to treatment.
Yep, better prognosis generally.
But the big message from Dr. Price and the sources is about action you can take before it ever starts.
Absolutely. Avoid tobacco completely.
Yeah.
Minimize alcohol.
Get the HPV vaccine.
And maintain a healthy, whole food-focused diet. Simple steps, but powerful.
It really drives home that prevention angle.
It does. And thinking about that treatability difference and the role of the vaccine, it sort of leads to a broader question for you, the listener. Yeah. Considering how effective the vaccine can be and the different outcomes for HPV-related cancers, what further questions does that raise for you about the potential impact of widespread vaccination on public health and cancer prevention overall? Something to think about.